Should all of us in the United States adjust to being good Europeans? Earlier, Indiana Governor Mitch Daniels went on the record. Governor, nice to see you, sir.
Hi, Greta.
How are you?
Well, I'm trying to think about basketball and Butler beating Syracuse. If I think about health care, I'd get too discouraged. So I'm accenting the positive.
Well, actually, if you and I would sort of even go back a little bit further, we both graduated from the same law school, Georgetown, so we're both Hoya, so we don't even want to go that far into basketball, I take it.
Yeah, well, you were probably a real student. I was just a humble night student, so my basketball loyalties are more Midwestern.
Yeah, well, I don't want to compare grades. I don't dare with anybody. All right, you've written an op-ed piece with the title that has a lot of people on fire, I imagine, which is headlined, "For now, we better start adjusting to our new status as good Europeans." What's with that, Governor?
Well, I didn't put the headline on. I think it was a little throwaway line at the end, but I'm trying to, in a sardonic way, maybe make a serious point, Greta, that this bill's about a lot more than health care. It's about what kind of citizens we will be, what kind of people we will be going forward. The premise of this bill is that the government will decide for the rest of us, and that we will submit. We will submit to higher taxes. We will submit to waiting in long lines for health care. We will submit to our health care choices being made for us by wiser people, those who run the bureaucracies of the state. And, you know, I think that's discouraging and regrettable, but that's why we have elections, and the congressional majority was entitled to do what it did, and it worked its will.
Well, it seems to me there are three sort of overriding issues. One is philosophy, whether or not you believe the government should be this involved in health care. Another one is whether or not we're getting improved care or not. And the third is whether or not we can afford it. So let me zero in on Indiana. You have about a 9.8% unemployment rate. How does this new health care bill, what's it going to do to your economy? Can you pay for it? Can you accommodate it?
Well, of course, the biggest effects are still a few years away, but this is really terrible in terms, I think, in terms of its economic effects. The two biggest drivers of growth and jobs in America are small business and investment. And so this bill taxes small business and investment very, very heavily. I think that's wrong-headed as economic policy, but that's, you know, the way they decided to pay for what they've done. There are also some very direct effects on Indiana. I suppose this is no concern to people elsewhere, but they nationalized the student loan industry, and that happens to be a strong business in our state. They're going to tax the highly innovative medical device businesses. We happen to be a capital of that, and they've added punitive taxes on them to minimize the extraordinary cost of this bill. So if it were good for America, people in this state would be for it, even though it has these especially negative effects on us. But in our case, I think we get it on both ends.
Well, according to your state senator, minority leader in the state Senate, it will mean 744,000 more people in Indiana will have access to health care, which sounds like, you know, that sounds great if you can afford it. And if you can't afford it, what would happen to these people, I guess?
Well, we've been working on the problem of the uninsured in a very different way out here, in a much more affordable way. It'll now be wiped out, and those people in our what we call the Healthy Indiana plan will be dumped into Medicaid, along with several 100,000 more of our fellow citizens. You know, one effect of that will be, long after I'm gone, a series probably of state tax increases here. The states, as you know, pay for a share of Medicaid. And so when you add hundreds of thousands of people, in our case, to those rolls, there'll be a state tax hike to go along with the higher federal taxes. This rather hidden tax is just one of the other costs of this bill that didn't get a lot of discussion before it passed.
Well, there's going to be a lot of discussion as we sort of unroll this health care bill and as we examine it and see how it affects each individual state. And, Governor, thank you very much, and good luck to you and to Indiana, sir.
Thanks for having us.
Next.